You know, one of the things that's really important right now is keeping your kids healthy, especially with them going back to school. There have been some schools already that have closed their doors once they got open because of the COVID thing. So school health and the children's health is very important. Well, we have join us in the studio here, Tara Tillman, who is with Coastal Family Health. Good to have you on the show.
Thanks for having me.
Tell me a little bit about yourself first.
Well, my name is Tara Tillman. I am an RN, and currently I'm the school-based health manager for Coastal Family Health. I've been with Coastal for about a year now. Majority of my 8 years of experience is in a local emergency room.
Okay. Now, you're working with school health. What exactly does that entail?
Okay. Our school health services with Coastal is what it is we're currently in Greene County School District, Moss Point School District, and Jackson County School District. At our Greene County and Moss Point School District, we have a functioning clinic in every school site. So Greene County has 5 schools, so we have a clinic in each school site. Moss Point has 4, we have a clinic in each school site. And we have a medical team that consists of a nurse practitioner, nurses and clerks, and behavioral health specialists that rounds to each school a certain day of the week. And we full function medical. We can see wellness, sick visits, COVID testing, immunizations, flu shots. And the big kicker is it's no out-of-pocket costs for the student.
Wow.
And it's no cost to the school district.
That's awesome. And you also have a medical mobile unit.
Yes, sir.
That can go out and I guess to the schools or anywhere.
Yes, sir. And that's currently what we're using for Jackson County now because we currently partnered with them in August. So our mobile unit is our clinic on wheels serving the Jackson County School District right now.
And what kind of, I guess it can do everything as well as COVID testing?
Everything.
You know.
From COVID testing to wellness to even, right now we're just using it for medical, but it also has dental services capabilities.
Really?
Yes, sir.
Now I know that's one of the things Coastal Family Health is known for is the wide variety of services that they can provide. You know, and whether it be the mobile unit or right there in the offices, and y'all have offices located all over the place.
Everywhere.
Everywhere. So now you go out to the schools.
Yes, sir.
Does the child have to have an appointment or?
Well, we cannot see any child if they don't have a parent or guardian consent. The parent or guardian has to fill out a consent giving us permission to have the child. But sometimes we have pre-made appointments, like a parent or teacher calls and be like, this child needs to be seen, so we check consent. They'll be on our schedule book. But a lot of times it functions kind of like an urgent care because, I mean, you can't really predict, hey, my child's going to get sick on a Thursday
right.
at 3 o'clock or whatever. So it functions in kind of like a walk-in and appointment clinic. Okay.
So if they have, any kind of, I guess, cough, cold, or anything like that, you say the teacher or the school nurse would contact you?
Yes, sir. Or the parent, teacher, school nurse, parent, they would contact us. Normally, how it functions in some of our school clinics is that morning the office will have a list of students that need our services, and then the way the parents have an option when they fill out the consent if they want us to do their wellness on their child, like their normal checkup, their normal 1-year checkup. And if they select that, we'll have them scheduled saying, okay, today we're going to do Sally Joe's 1 year.
Okay. So that's something, you mentioned the 1-year checkup. Is that something that you recommend the parents have scheduled for their children every year? Is a 1-year checkup?
Yes, they need to follow up at least. It's an annual checkup, just like me and you. We all need to go to our checkup.
Right.
Even if we're healthy, we just make sure we're meeting. There might be certain immunizations we need or just some basic lab work just to make sure we're on the right path growing, and that's especially important for pediatrics. But now if they have their own pediatrician, we're not taking the place of them. If they want to do their annual checkup with their pediatrician, that's perfectly fine. We'll just be a helping hand whenever they need us.
Okay, so if they have, what age do you usually recommend them starting to do their 1-year checkup? I mean, in the schools, I guess as soon as they start school? Or
Yes,
they
sir.
probably should have done that before they started school.
Yes, sir. With pediatrics, not to get too deep in it, actually at birth there's a certain amount of checkups, and the 1 year is definitely for school age. Most kids have pre-K, so it's 4 till.
Well, they have to have their immunizations, depending on how old they are. I mean, just like you said, and I hate to use this as a correlation with the children, but it's like a puppy. They they have their shots that they're supposed to get every year. I mean, when they start out little, they get their shots and everything, so they grow up to be healthy and don't have any issues.
Yes, sir. And with the vaccines, the shots, Mississippi actually has required school vaccines that they have in order to attend public school.
And you keep up with the records and everything on the children, or if you've never seen them before, I guess the parents can provide those records to you?
Oh, well, if they're in state and views, they got their shots within Mississippi. Mississippi has a mix program that keeps up with vaccines of the children's that we have access to. Now, if they're out of state, the parents would have to bring the shot record so we can enter it into the Mississippi mix system.
Okay. Are there any things that you don't deal with as far as, with the children in the schools?
It's related to the field. Like some school districts wants us to stay away from some.
Yeah.
Mainly regarding sexual, birth control, and all of that. So it depends on what the school district allows.
So, well, you mentioned that. So I guess you go up all the way through high school?
Yes, sir. And we see staff there as well. Any school different staff is able to be seen for their copay. They don't have no out-of-pocket costs. The out-of-pocket just qualifies for the students, but the staff can be seen within school hours for just their traditional copay of their insurance.
Okay. Now, you mentioned copay insurance. To be able to see you or you see one of the children there, does the parent have to provide the copay, or is this something?
No, sir. With the students, if they're a student of the school district, they are no out-of-pocket costs. That means if they have insurance, we only charge what the insurance will pay. If the insurance don't pay, we write off the rest. If they don't have insurance, it's completely free service.
Okay.
So there's no out-of-pocket cost to the student or the parent or the school district. The school district just gives us the space, and we come in and make it the clinic. Okay,
that's great. So I'm sure you've set up in cafeterias or the gym or
we are JCO certified, so we have a board. So we do have it's a functional clinic, so it meets all our certifications.
Okay.
And it's within the school. They give us a space, and we come and turn it into a medical clinic.
Oh, that's nice.
Kind of like a one-shop-all. Like majority of the time, it's either in a classroom or we have some mobile home clinics in our Greene County School District.
Okay, portables as we used to call it.
Yes, sir.
Little portable units. Okay. Well, I guess if they need any more information, they can call Coastal Family Health and find out exactly where you come to, the schools that you deal with.
Yes, sir.
Okay. Thank you so much for being here on the show. This is great. Again, tell me the counties that is Jackson County.
We're in Jackson County, which is Van Cleve, St. Martin, and East Central. And then we're in Moss Point School District and then Greene County School District.
Okay, great.
Thank you.
You're doing some great work. Thank you very much, Tara. All right, Coastal Family Health doing some great things for the children. If you'd like some more information, you can go online and again to the website, give them a call and see if they're coming to your area for your child. Coastal Family Health.